Bismillahirrahmanirrahim. If you cannot do great things, do small things in a great way. A mother is a walking miracle, and on 11th April, there is a National Safe Motherhood Day. And today, my topic of presentation is Safe Motherhood under kind supervision of Professor Dr. Saira Afzal. Learning outline of my presentation is introduction about safe motherhood initiative, pillars of safe motherhood, strategies regarding safe motherhood, and recent updates. At the end of this presentation, participants will be able to describe the safe motherhood initiatives, pillars, and strategies of safe motherhood and recent updates. This picture shows the cause of maternal mortality globally, and in this graph you can see that the major cause of maternal mortality is hemorrhage, and then other causes like hypertensive disorder, unsafe abortion, sepsis, obstructed labor, and other direct and indirect causes. Every day, approximately 830 women die from preventable cause related to pregnancy and childbirth. 90% of all maternal deaths occur in developing countries. Maternal mortality rate is higher in women living in rural areas. Skilled care before, during, and after childbirth can save the life of women. Between 1990 and 2015, maternal mortality worldwide dropped by about 44%. Now coming towards introduction, safe motherhood encompasses a series of initiatives, practices, protocol, and services, delivery guidelines designed to ensure that women receive high quality gynecological, family planning, prenatal deliveries, postpartum care in order to achieve optimal health for the mother, fetus, and infant during pregnancy, childbirth, and postpartum. What is Safe Motherhood Initiative? First International Safe Motherhood Conference in Nairobi, jointly sponsored by WHO, UNFPA, and World Bank in February 1987. Action to reduce maternal morbidity and mortality. They also give pillars and strategic intervention about safe motherhood. Safe motherhood becomes part of reproductive health in International Conference on Population Development ICPD in Cairo 1995. In 1995 Fourth World Conference on Women in United Nations on Family Planning and Women's Empowerment. Goal of safe motherhood is to improve well-being of mother through a comprehensive approach of providing, preventing, promotive, curative, and rehabilitative care. These are the four pillars of safe motherhood which was proposed initially, and in this pillar there is a family planning, antenatal care, clean and safe delivery, essential obstetric care are added, and basic maternity care, primary health care, and equity for women. And then after this four pillar model, there is proposed a six pillar model for safe motherhood, and two more components are added in this pillar. And the components are family planning, STD, and HIV control. So the six pillars are family planning, antenatal care, obstetric care, postnatal care, abortion care, STD, HIV control. These two pillars are added in six pillar model. Now we discuss one by one these six pillars. Family planning to ensure that individual and couples have the information, services, plan the timing of pregnancy, number of children, and spacing of pregnancy. Antenatal care. Good antenatal care is necessary to examine expectant mothers at home as well as clinics, educate the mothers, give instruction regarding the care of newborn, detect any abnormalities. 4 antenatal visit is recommended or more than 4 antenatal visits. Clean and safe delivery. To ensure that all birth attendants have the knowledge, skills, and equipments to perform clean and safe delivery, provide postpartum care to mother and baby. Essential obstetric care. To ensure that essential care for high-risk pregnancies and complication is made available to all women who need it. Now comes toward post-abortion care. Post-abortion care saves life. Abortion may be illegal, but post-abortion care is always legal. And there are 5 components of post-abortion care: community service provider partnership, counseling, emergency treatment of incomplete abortion and its complication, family planning, counseling about family planning linked with other reproductive services. Sexually transmitted diseases control. This is the 6th pillar of safe motherhood model. Screen and prevent and manage transmission to baby, assess risk for future infection, provide voluntary counseling and testing, and encourage the prevention. Now come towards the strategies of safe motherhood. Promoting intersectorial collaboration for safe motherhood at central, regional, district, and community level. Promote research on safe motherhood to contribute to improve planning, higher quality services, and more cost-effective intervention. Supporting activities that raise the status of women in society. Expanding delivery by skilled birth attendants and basic comprehensive obstetric care services. Developing, and for achieving this purpose, developing the infrastructure for delivery and emergency obstetric care, establishing functional referral system and advocating for emergency transport system, strengthening community-based awareness on birth preparedness. The Safe Motherhood South Asia Conference in Lahore, Pakistan in 1990 reported that motherhood is more dangerous for women in South Asia than any other part of the world except Sub-Sahara Africa. Each time a woman in South Asia becomes pregnant, she faces a risk of dying that is 31 times higher than in the developed world. The cause of high maternal mortality in the region reflect demographic and socioeconomic factors as well as inadequacies of healthcare system. Women being childbearing age, young, continue until an advanced age and have many pregnancies which are poorly spaced. They have little access to health services, malnourished due to poverty and socio-cultural tradition, and mostly women are uneducated. In order to address this conference, the Social Action Plan of Pakistan are formed and SAP strategy for primary health include improving the efficacy and utilization of basic healthcare, improving program design by paying more attention to quality, increase access to healthcare by constructing more facilities, increase women access by recruiting more female staff, promoting community participation in the design and management of healthcare services. Now come towards recent updates. What is White Ribbon Alliance? For Safe Motherhood, White Ribbon Alliance is a grassroots movement that builds alliances, strengthens capacity, influences policy, and inspire action to save the life of women and newborn around the world. White Ribbon Alliances in Pakistan, founded in 2006, 2006, White Ribbon Alliance Pakistan Unite public health expert, safe motherhood activists, researchers, and media representatives that are committed to safe motherhood in Pakistan. White Ribbon Alliance Pakistan vision is Pakistan where all women and girls realize that their right to quality health and well-being. Our mission is to activate a people-led movement for reproductive, maternal, and newborn health and rights, complementing advocacy with accountability, bringing community voices together, and moving toward multi-sectorial approaches have been some recent transformation at White Ribbon Alliances in Pakistan. These are the achievement of White Ribbon Alliances campaign, and they will directly contribute to the targets under Sustainable Development Goal 3 by realizing human rights and amplifying citizen voice to create demand for health, reduce the global maternal mortality rate to less than 70 per 10,000 live births, and preventable death of newborn and children under 5 years of age, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 100 live birth and under 5 mortality to at least as low as 25 per 100 live birth. Ensure universal access to sexual and reproductive healthcare services, including information, education, family planning, and integration of reproductive health into national strategies and programs. This is the article about safe motherhood in Pakistan, past failure and future challenges. The death of Pakistani women during pregnancy, delivery, or immediately after delivery and of her newborn is a calamity of incalculable dimension, not only for her family and community. For prospective health policymakers and planners of paramount significance to the health and well-being of the country. What makes this tragedy unacceptable is the fact that high maternal mortality ratio have remained essentially unchanged for nearly 3 decades of data which are compiled from various articles. As what are the future challenges? As we move into the 21st century, the real challenging facing our nation in the context of safe motherhood is its implementation maternal health policies. The essential core of Pakistan's Safe Motherhood Initiative should be an intersectorial, multi-level programmatic framework that links the common woman and man in the community, obstetrician, midwives, nurses, and educators, and is supported by a strong political commitment at the national, provincial, and district level. These are the facts and figures from Pakistan Maternal Mortality Survey 2019. And according to this survey, there are change in the trends of antenatal care coverage. 91% women now achieving the antenatal care. Over the past 3 decades, antenatal coverage by a skilled provider has improved dramatically from 26% to 91% in 2019. And you can see in this graph, in the Pakistani Demographic Health Survey in 2017 and 18, the ratio is 87%. And now, according to 2019 Pakistan Maternal Mortality Survey, the antenatal coverage reaches almost 91%. The timing and number of antenatal visits are also important. More than half, 56% of ever married women had their first antenatal visit in the first trimester to the most recent live birth. More than two-thirds, 68% of women took iron supplements or syrup during pregnancy. 70% of women most recent birth or stillbirth were protected against neonatal tetanus. This is another figures from Pakistani Maternal Mortality Survey 2019, and this is about the place of birth. And there is also change in this trend because in past 2 decades, the delivery place is mostly home, but now the trend is changed, and the deliveries is on health facility sector, and this ratio is also increased from 29% to 71% in 2019 survey. 71% of live births are delivered in a health facility, primarily in private sector facilities, while 3 in 10 births are delivered at home. Births to women with higher education and those in wealthiest household are more likely to deliver at health facilities sector. Regionally, health facility deliveries ranges from 51% in Balochistan, and it is more in Punjab, which is 75%. Safe motherhood and COVID-19. Updates regarding the safe motherhood, and in this I will tell about the breastfeeding. My other colleagues also highlight this aspect. Adherence to infection prevention and control measure is particularly important to prevent contact transmission between COVID-19 mothers and their newborn. Wash your hand with soap and water or a hand sanitizer with at least safe motherhood alcohol for at least 20 seconds before touching the baby. Breast pump or bottles if she chooses to feed express breast milk using a bottle. Try to avoid coughing or sneezing on the baby while feeding. Wear a mask while feeding or breast pumping. Follow recommendation for cleaning the pump or bottle after each use. Consider asking someone who is healthy to feed the expressed breast milk to the baby. These are the recommendations for COVID-19 mothers. They must breastfeed their babies. Vertical transmission of COVID-19. Most global cases of COVID-19 have evidence of human to human transmission. The virus can be readily isolated from respiratory droplets, secretion, feces, and surface objects. Transmission of the virus is known to occur most often through close contact with an infected person. Perinatal infection rate is estimated to be 2.5% and mostly occur in women who contracted the virus within a week prior to delivery, 14 days. What is mother baby package? According to WHO, if we want to successfully achieving the goals of safe motherhood, then we implement the mother baby package. It is a practical guide. What is the mother baby package? The mother baby package describes each intervention needed to achieve safe motherhood in the short term. It represents the synthesis of activities at different levels of healthcare system and define a basic set of health system intervention and activities that cannot be further reduced. The package describes simple intervention needed before and during pregnancy, during delivery, and after delivery for mother and newborn. It outlines what can be done to prevent and manage the major obstetric complication in the community at the health center and at the hospital. It focuses only on those interventions known to be effective which can be implemented by making the most efficient use of available sources. Some intervention can be delivered at community level by ensuring that women and their families have the information they need to care for themselves during pregnancy, delivery, and seek assistance when appropriate. Much of this information can be channeled through community-based facilities such as health posts, dispensaries, and trained traditional birth attendants. How we can done the implementation of mother baby package. The district health system is the basic unit for planning and implementing the intervention outlined in the mother baby package. The district provides a mechanism for linking families and communities with health center and hospitals in a functional, cost-effective manner. Through district-based implementation of intervention, it is possible to ensure that health services are available as close as possible to people's homes. Now come towards the MCQ session. Safe Motherhood Initiative was launched in Nairobi, February 1987, March 1987, April 1987, May 1987.
C.
B.
A is correct answer, February 1987.
Dr. Naila, again, it is a recall-based question, and I have been saying this and repeating this for a very long time that please don't show the MCQs like this. So please go ahead. Your MCQ number 1 and number 2 both are incorrect. Both are on recall, and they are not up to the mark. Please go to your MCQ number 3.
WHO strategy for safe motherhood does not
Go to
include.
no, this is again on recall. Please go to your MCQ number 4.
Ma'am, it is also recall.
Please go to number 5.
One of
Again,
the
it
main.
is recall based. Next,
Ma'am,
please.
almost all MCQs are C1 level.
Number 6, please.
What is the percentage of attaining antenatal care according to Pakistan Maternal Mortality Survey 2019?
Nobody will answer this MCQ because it is not for the postgraduate students. Next, please. Next, please. Next, please. Next, please. Please go back to question number 9. Dr. Naira, this question, it is very confusing. Is it an MCQ or it is to produce more confusion about the mother and child health? Please leave this meeting. We would again join the link in order to have the feedback on this session.